What is the detrusor muscle's role in bladder post-void residual volume? Have you ever wondered how your bladder works to empty itself completely? The detrusor muscle plays a key role in this process. This smooth muscle layer is located in the bladder, while and is responsible for contracting to expel urine during urination. It also relaxes to allow the bladder to fill and store urine. The proper function of this muscle is crucial for effective bladder emptying and minimizing post-void residual volume, which is the amount of urine remaining in the bladder after urination. When your bladder fills up, stretch receptors in the bladder will detect this fullness. This triggers signals from the parasympathetic nervous system, causing the detrusor muscle to contract strongly and uniformly. This contraction decreases the bladder volume by squeezing urine out through the urethra. At the same time, the internal and external urethral sphincters relax to allow urine to flow out. A strong and coordinated contraction of the detrusor muscle typically results in minimal post-void residual volume, indicating that the bladder has emptied effectively. However, if the detrusor muscle is weak or uncoordinated, a condition known as detrusor underactivity can occur. In this case, the muscle cannot generate enough force to fully empty the bladder. This leads to increased post-void residual volume, which can cause urinary retention. This condition can increase the risk of urinary tract infections and even bladder damage. On the other hand, if the detrusor muscle is overactive, it can cause urgency and incontinence, but this does not directly increase post-void residual volume. In the context of bladder health and bladder cancer, any abnormalities in the detrusor muscle's function or structure can impair bladder emptying and increase post-void residual volume. For instance, hypertrophy of the muscle can occur due to bladder outlet obstruction, or the muscle may be invaded by cancer. Elevated post-void residual volume is an important diagnostic parameter that healthcare providers assess during urological evaluations. Persistent high residual volumes can contribute to bladder dysfunction and complications. In summary, the detrusor muscle's role in bladder post-void residual volume is central to how well the bladder empties. The strength and coordination of its contractions directly determine how completely the bladder can empty. Dysfunction of this muscle can lead to increased residual urine volume, which has significant implications for bladder health and can complicate conditions like bladder cancer. Monitoring post-void residual volume is essential for assessing detrusor muscle function and guiding the diagnosis and management of bladder disorders. Always consult with a healthcare professional for personalized medical advice regarding bladder health.